You're good to go.
Okay. Hi, good morning. This is Leigh Howard from Diana T. Myers and Associates. I'm joined this morning by Brendan Aumann from DCED and Maria Williams from the Pennsylvania Coalition Against Domestic Violence. Thanks for your patience in getting started this morning. This feels like the little webinar that could at this point. For those of you who were on tap to participate on Friday, I'm sorry that we had to cancel and reschedule for today, but everybody is on the phone and healthy and ready to roll. And apparently I'm overcoming my technology deficiencies in live real time here. So thanks for your patience this morning. Brendan, if you could go to the next slide, that'd be great. Thanks. So this morning, we're going to, first of all, I just want to say that we had a domestic violence best practice webinar in September of 2018. This is the 2019 version. It will not be a repeat of last year. There may be some information that's sort of carried over from last year, but the majority of the information presented today was not included in last year's webinar. Having an annual training provided to the CoC on best practices for serving survivors of domestic violence is a HUD requirement, and even if it weren't, it's best practice to ensure that all folks who are engaging with survivors throughout the CoC really have a solid grounding in understanding that population and strategies for best serving that population as well. So we're thrilled to have Maria Williams from PCADV on the line to really help us better understand both of those things. In addition to that, today we're also going to review some information that if you attended the eligibility training that we did back in May, it hopefully will sound very familiar to you. We have, myself and I know Maria as well, and I know others such as the regional managers through coordinated entry have been receiving a number of questions still around eligibility for assistance among Category 4 survivors, and so we're going to review that again. Hopefully, like I said, it will be a refresher and sound very familiar if you attended that training, and if you didn't, hopefully this information will help to inform your work. And then finally, we're going to talk about emergency transfer plans. It's going to be a little bit broader than that, but that's the focus of that last section. We're going to be talking a little bit about HUD's VAWA final rule, which includes requirements around emergency transfer plans. Next slide. So with that, I'd like to turn it over to Maria to do an overview of best practices.
Good morning, everyone. Thanks so much for joining us on this webinar today, and I'm hoping that it will be insightful to everyone. Is it possible, Brendan, to ask questions in the chat?
Yep, that is correct. If you have a question and you are logged on through the Skype, you can type in the chat box and ask a question, and either Maria or myself can field those questions.
Great, thank you. So those of you that have been in trainings and conversations or whatever with me before know that there's only so long that I can be interesting. So if you, even though we all are virtual today, if you could ask questions as we go, I think that will inform the nature and direction of the training, because what we want to make sure that we're doing is addressing the concerns that you have rather than just making assumptions that this is what's needed. So as we're going, if there are specific things that you have questions about or issues that we're not addressing, please feel free to share those in the chat box. We can go to the next slide. So I wanted to start today with a general definition of domestic violence. Throughout the day, or throughout the training today, we're going to talk about not just domestic violence, but also sexual assault and human trafficking. But my expertise is in domestic violence, and the majority of the laws around housing were started with supporting survivors of domestic violence and have since expanded. So domestic violence is a pattern of coercive behavior by one person to gain power and control over another in an intimate or familial relationship. And this is the working definition that PCADV uses. Many folks have different definitions of domestic violence, and that's fine. What we want to make sure that you all understand is that there's the legal definition of domestic violence, and then there's what we all deal with every day. And that's folks coming to us and saying that they are experiencing violence in some form or another, or surviving violence in some form or another. And even though they may not have protection from abusive order or a police report or anything like that, they still are surviving domestic violence. And just for clarity, there are many folks that use the word victim when they're talking about people that are experiencing domestic violence, and there are many of us that use the word survivor. Those can be used interchangeably. Pardon me. What we find is most frequently in strengths-based social work sort of language, we use the term survivor. When folks are dealing with the legal system or the medical system, they're most often use the term victim. So neither is right or wrong, and many people use them interchangeably. Today I'm going to use the term survivor. The other terms that I wanted to make sure are out there is we talk about domestic violence, but it can be referred to as many things. Intimate partner violence is another one that we use frequently, or IPV. And then there's been a lot of questions around whether or not domestic violence is only intimate partner violence. And what we want to make sure at PCADV is that we provide a platform for folks that are experiencing interpersonal and familial violence across the board, rather than just intimate partner violence. In the legal definition, intimate partner violence is what falls, but we know that domestic violence happens within families in many different ways, and we work to make sure that that's all lifted up here at PCADV. So my role here at PCADV is to specifically address the intersection between housing and homelessness and domestic violence. And so what the statistics that we talk about frequently are 1 in 4 women and 1 in 7 men have experienced physical abuse from an intimate partner. But the important piece, I think, for all of us on this webinar today to know is that national data shows that 80% of homeless families report domestic violence in their past, and 50% cite that domestic violence is the cause of homelessness. So those are the factual statistics. I think that anecdotally, what we can say is that we know that the majority of families that we work with in the CoC have experienced domestic violence at some point. And whether or not that's the direct cause of their homelessness, it can often be directly linked, even though it may not be the cause of the homeless incident they're experiencing this time. There's often a direct linkage, and that's why it's really important. We can't talk about ending homelessness without also talking about ending domestic violence. The two go hand in hand, and that is my role at PCADV and within the CoC, is to make sure that that is addressed and that you all have the information that you need to be able to serve survivors of domestic violence within your programs and within the CoC to the best of your ability. Coercion is an important piece of this, and that's often the act that occurs that really keeps folks homeless for a long period of time. So coercive behavior is the idea that a survivor is being sort of engaged in push-pull behavior, that an abusive partner will give them the things that they need and help them in the ways that they're asking, and then all of a sudden withdraw that help and support. And that can look oftentimes like financial help and support. holding finances over a survivor's head and saying, if you don't stay with me, then you're not going to have access to money, or never giving a survivor access to money. It can also look like holding children over a survivor's head, and the idea that if you leave, you'll never get to see your kids again, or if you leave, you'll be homeless and it'll be much harder for you to see your kids, so you have to stay. And it's these sort of behaviors that keeps a survivor intertwined with their abusive partner, as much as they might not want to be. When money and finances and housing and kids and this sort of structure is being withheld in the face of violence, you often will concede to the violence rather than losing those things. But what we know, and the majority of folks that you all work with are survivors that have reached the point where they can't handle that any longer, and they want to make changes in their life, or they at least want to begin to explore what those changes could look like. And what we see then, the direct causal link between domestic violence and homelessness, is that people leave, they have nowhere to go, which is an obvious one, but also people leave and they have no access to finances. And so there's no way for them to support themselves once they do leave, which often leads to homelessness, or at the very least, housing instability. What we're seeing, and the reason that my position exists and the reason that we're focusing on this today is in the ECOC and statewide in Pennsylvania, we never want a survivor to have to choose between being homeless and staying in an abusive relationship. So the more resources that we can put within the CoC to make sure that never happens is essential. We can go to the next slide. So we've talked about some of these today. Domestic violence can look like a whole lot of things, and if we were together, we could make this list 12 times longer than it is. But these are the sort of hallmarks of domestic violence that we see over and over again. And we've talked a little bit about financial abuse already today, but this is the key component oftentimes that keeps survivors homeless or unstably housed. And it's often the thing that is most frequently overlooked, because we, as a society, are very used to domestic violence being defined as a man hitting a woman. And what we know is that domestic violence can be far more complicated than that. We know that men are survivors of domestic violence. We know that people that exist along the gender binary or outside the gender binary are also survivors of domestic violence. People within lesbian and gay relationships are survivors. And so that stereotypical idea of a man hitting a woman is not the only thing that exists, but it is actually the most common thing that exists. It's at least the most reported on. And so those are the numbers that we use when we're talking about domestic violence, that women are more frequently abuse survivors. But the more insidious forms of domestic violence happen, especially when you're talking about financial abuse or verbal abuse or sexual violence, the sort of things that people don't talk about and aren't easily seen, which is why it can be really confusing when a survivor comes to you in a housing program and says that they've been experiencing all of these things, and whether or not that qualifies them as a survivor of domestic violence can often be confusing. But what I want to support you all in, and what we know, is that if a survivor is saying, I'm surviving domestic violence, we want to believe them. And we're not here to prove anyone wrong. What we're here to do is say, that sounds like this has been a terrible situation for you, and what can we do to help you move through it? Because what we know as providers is that domestic violence is far more complicated than a man hitting a woman. If we can go to the next slide. So in the domestic violence field, one of the things that we have done to really address this link between domestic violence and housing is to look at the housing first work that has been done and adapt that and modify it to serve survivors of domestic violence. So Housing First was developed in New York City and in Philadelphia, and really grown to show efficacy within populations that have been traditionally considered hard to house, which isn't a concept that we endorse, but is one that exists in the field. And what was found is that the sooner a person or a family could get into housing, the more stable they became more quickly. And the domestic violence field saw that work and saw how successful it was and realized that this was going to be a great answer and piece of the puzzle to really begin to solve homelessness for survivors of domestic violence. There was a need to move away from the traditional model of service. And what that looks like was a survivor calling a hotline and then coming into a confidential shelter. And what we know is that buildings are very rarely confidential. And most of the time, domestic violence shelters exist on a piece of donated property behind a church with a huge fence around it and security cameras, which isn't, if you're looking to hide, is probably not the best place to hide. And we were seeing that abusive partners would know where the shelter was, and so that wasn't the most safe and confidential location for a survivor. And then honestly, even more importantly than that, once a survivor left shelter, they were homeless. And the domestic violence field has never been good at providing permanent housing options for survivors. That's a new thing. And what we saw in Pennsylvania is there was significant need. And had been really already begun to be worked on by domestic violence organizations in the East CoC, like Transitions and Huntington House and the Women's Resource Center, that they are already providing permanent housing, and we're seeing great results from that through partnership with the CoC. And the PCADV looked at that success and wanted to replicate it elsewhere. So what we are doing here at PCADV is taking that success and looking at non-traditional models of housing for survivors. So not closing shelters, not moving away from shelter, but asking the question, what aside from shelter is needed to make sure that survivors never have to choose between homelessness and staying in an abusive relationship. So here in the East CoC, particularly what we're looking at is the growth of rapid rehousing money specifically for survivors of domestic violence, and then also Home for Good funds using prevention and diversion models with survivors of domestic violence to keep them housed if that's something that's safe from them, to let them avoid shelter altogether, because we know that once a family becomes homeless, even if it's domestic violence shelter, they're much more likely to become homeless again. So we want to avoid that altogether. And then look at the efficacy of the work that we're able to do here in the East with the combination of those funds and the model of service that goes along with the domestic violence housing first, which we'll talk about in a moment, and then scale that on a statewide basis. So the idea is that in a number of years that the entire state of Pennsylvania will be engaged in the domestic violence housing first model of service and practice, and assuring that survivors have other options aside from just engaging in emergency shelter or staying in an abusive home. We can go to the next slide. So the service component that goes along with domestic violence housing first work is actually the most important. What we hear from survivors over and over again is that the funding, the rapid rehousing money, the prevention and diversion money is fantastic, but the thing that really was important is the service that went along with it. And this is something that if we're all working on this statewide, and this is how we all view serving survivors of domestic violence and frankly, and serving anyone that is experiencing homelessness or housing instability, that only furthers the ability for survivors and those that are living on the margins to stay housed. So one of the key components is survivor-driven advocacy. It's either survivor-driven or victim-defined. It's talked about both ways. Jill Davies is a attorney in Connecticut who wrote a book called Domestic Violence Advocacy. And she talks about victim-defined advocacy as offering options, resources, and strategies that are relevant to the victim's priorities, decisions, and risks. And the whole idea is that this is done in a way that supports the autonomy and independence of the survivor, rather than saying, we're the experts here and we want to tell you what to do. What it does is lift the survivor up to actually acknowledge that they are the experts in their own life and allow them to drive the bus, so to speak, and make sure that they are making decisions in their own lives, and that we're providing support and resources to encourage those decisions. What it doesn't mean is that if a survivor is making a decision that we have some concern about, that we just sort of sit idly by and say, well, this is survivor-driven advocacy, and so we don't want to get in the survivor's way. What it does is require really trained counselors and case managers or advocates, which is what case managers in the domestic violence field are often called, to stand in that space with the survivor and say, I hear you, but have you thought about this? And if I were going to make that decision, here are the things I would be concerned about, and really engaging in honest, authentic conversation with the survivor to help them make good decisions about what housing stabilization looks like for them. And then the other piece of that, which has been worked on here in the ECOC previously, is trauma. We all have spoken about this before, but sort of the hallmark of this is making sure that we understand as providers that trauma impacts and influences people's lives in ways that we don't see and we don't understand, and that's okay. And as long as we're standing with them in that space and supporting healing and resiliency and reducing re-traumatization, we can work to reverse the impact that trauma has had on their life, rather than further it by doing things like having strict program requirements or qualifications to entry or things like that we as a CoC have already moved away from. If we can go to the next slide. So there are really three things I think for providers to remember when serving survivors when we're talking about best practices. And those three things are safety, confidentiality, and being trauma informed. We never expect folks who are not experts in serving survivors of domestic violence to suddenly become experts in serving survivors of domestic violence. I think that there's always a lot of risk involved when folks who don't have extensive training in serving survivors engage in that work. And it's important that that risk is acknowledged, but it's also important to remember that the majority of at least families that you serve have been or are currently surviving domestic violence. So this is a population that you actually are familiar with and know how to work with because you're working with them every day in your program. One of the ways that I think that housing providers can really engage in safety is to, of course, ask a survivor what they need and know that, the work that's done with a survivor needs to be highly tailored to those needs, but then also reaching out to your local domestic violence provider and partnering with them, because we don't, again, expect you to be the expert in everything. You have experts in your community. And reaching out to them and making sure that they're engaged in the work that you're doing, even if they're not engaged with the survivor that you're currently serving, because the survivor has the right to say that they don't want to be engaged with the domestic violence program, but offering that to see if a survivor has even considered it. And if they are open to it, hooking them up with the DV program to talk extensively about safety planning and options and legal services and all of these things that our member programs do and do so well, to not have that burden on you as a mainstream housing provider is really essential. Confidentiality is so important, and making sure that survivor story is kept without any sort of record in HMIS and that sort of thing, or even without telling other folks who don't have the right to know. And people that have the right to know are people that the survivor has said to you, I need you to help me navigate the situation, and I've signed a release and you have my permission to talk to them. Otherwise, you don't have permission to speak to anyone else about a survivor story, because we know that that is the sort of thing that puts survivors at great risk. The piece then that's really important is making sure that not only are you providing trauma-informed services, but part of trauma-informed services is also looking at how trauma is impacting you. So if you're hearing survivor stories and you know you can't go out and tell people and process through that trauma in public, what can you do to process through that trauma personally? Who in your support network can you speak to about what's going on without disclosing personally identifying information, but still making sure that you're moving through other people's trauma in ways that are helpful and beneficial to you? That's going to allow you to be a better service provider. It's going to allow you to support survivors in a more thorough way and engage in your work in the best way possible. If we can go to the next slide.
All right. We are moving into the next portion of the webinar and looking at eligibility. Again, this is specific to individuals who are fleeing domestic violence. We're going to talk about that term a little more broadly. Hopefully folks had a chance to review the Category 4 document. That's obviously not the official name, but Maria shared a document that was circulated in advance of the webinar that really sort of broke down the different concepts within the Category 4 definition. And if you haven't taken a look at that, I would really encourage you to print a copy and have it handy as a easy reference guide, or keep it somewhere obvious on your computer, because a lot of time and thought went into trying to make sure that not only did folks understand the definition, but that there were good examples of folks who would be eligible, et cetera, within that document. So we're going to review some components of that this morning, and feel free, if you have not already taken a look at it, to refer to it. It looks like if you can see the chat box, Jessica from my office, Jessica Sones, it's just provided the link to that document, which is great. So for those of you who have been doing this work a long time, you know that there are 4 categories of homelessness under the Hearth Act definition. Category 1 is literally homeless. When we talk about that, we're typically talking about folks who are in an emergency shelter situation or in an unsheltered situation. So somebody you would count during the unsheltered pick count, for example. I know folks are working on that right now to prepare. So folks who are sleeping outside in tents, in sort of hunting cabins or something that don't have, is not considered a regular structure intended for sleeping, especially during January. Folks who are sleeping in their car, sometimes behind buildings. We get a lot of forms from behind the Walmart, et cetera. So those are folks who are typically considered as literally homeless. In addition to that, folks who are in shelter, which includes DV shelter. It includes folks who are receiving assistance by way of a hotel-motel voucher from a charity or government or whoever, but who are getting assistance from somebody other than family or friends or their own resources to cover a hotel stay. Secondly is Category 2, imminent risk of homelessness. Those folks are 14 days from being homeless and have documentation available to demonstrate the imminent nature of that risk. Category 3, so this is everybody else. So when you talk to the folks in your school district about youth and children who are eligible under the school definition of McKinney-Vento, that falls into Category 3. Folks who are eligible as homeless for Medicaid, for food stamps, for anything, for any other federal benefits, most of them all fall into Category 3. And then Category 4 are folks who are fleeing or attempting to flee domestic violence. Next slide, please.
So Category 4 definition has a lot of ands in it, A&Ds, and so we want to make sure that you all understand, and I know that many of you have already heard us speak about this, so I'll keep it short, but the definition of fleeing or attempting to flee domestic violence is any individual or family who is fleeing or attempting to flee domestic violence, dating violence, sexual assault, stalking, or other dangerous or life-threatening conditions. What we now also know is that survivors or people that are attempting to flee human trafficking also qualify as homeless under Category 4, and that they have no other residence, and we'll talk more about that in a few minutes, specifically on slide 13, and that they lack the resources or support networks to obtain other permanent housing. So this is complex at best, but it's important to sort of pull it apart. The document that is sent out was co-authored by PCADV and the National Network to End Domestic Violence, and took examples of fleeing from Pennsylvania, from domestic violence providers in Pennsylvania, to highlight what fleeing means. And so the important part to look at this is that we're reviewing, looking at the definition of domestic violence and reviewing that is important, because what we know when we say domestic violence is that doesn't have to mean physical assault, that it can mean a whole lot of other things, including financial abuse and emotional abuse, which are things that we don't frequently see. And so it's important that if someone is lacking resources and there seems to be coercion around that from the story that they have spoken to you or that they have told you, then asking them, have you ever felt afraid, or that like someone else has control over your finances? Have you been afraid to speak to that person about that? Is this person someone that you live with in your family? Is this person your boyfriend or girlfriend or husband or wife? Establishing these sorts of things allows us to make sure that people are eligible under Category 4 for permanent housing resources within the CoC. Having no other residence is also an important piece to look at, because we know that a survivor oftentimes will leave and go to a family member's house, but their abusive partner knows where that family member is, so they can't stay there. So even though they would be technically couch surfing under other CoC standards, under Category 4, they are not. They are still considered homeless because they can't stay where they're sleeping. That could even be that, their abuse partner doesn't know where they are, but their mom has a voucher and she can't have another person in her apartment, or it's just not going to work out for them or be a healthy or safe situation. The survivor doesn't want to be there. They want to have their own apartment with their children, or they want to choose who they're living with rather than being forced to live with someone that they wouldn't choose otherwise. So that is all falls under the definition of having no other residence. and then lacking the resources or support networks to obtain other permanent housing. This means that they are financially burdened and can't afford to go out and rent another apartment, or they would just do that, or sign another mortgage. They would just do that. But the other important piece of this is support networks. So what that may mean is that they do financially have the ability, but they have been so isolated by their abusive partner that they wouldn't even know where to begin to look for housing or to go through the process of obtaining a lease because they have been so isolated by an abusive partner. And this is actually very common. An abusive partner may or a person may get into a relationship with a person when they are 17 or 18 and stay in that relationship for 10 or 15 years, when the majority of folks are learning sort of how to navigate adult life, and their abusive partner has actively kept them from that, and has isolated them in the process, and so they've lost touch with family and friends. And so figuring out how to even get into a lease with an apartment may be something that they have never done before. So that would fall under the definition of support networks to obtain other permanent housing. We can go to the next slide. So we talked a bit about this already, but it's important to remember that the concept of fleeing looks different in every survivor situation because every survivor situation is different. It is important to ask good questions to see if a person is surviving, if that's a hunch that you have. And these are examples of some of the questions. One of the things that I think is particularly complex to ask about, and something that PCADV will be providing training on in the upcoming year, is really trying to deduce whether or not a person is surviving human trafficking, because that can look like a whole lot of different things, everything from the sort of traditional idea that we have about people being trafficked, particularly for reasons of labor, and other things like that, but also it can look like a person having to engage in activity that they wouldn't otherwise engage in to make money for the household because their abusive partner is telling them to, things like that. So trafficking is really complex and something that PCADV will be rolling out in the next year is more training on that. And so we'll keep everyone up to date. But a great question to ask about is someone making them do something that made them feel unsafe or uncomfortable in order to continue to stay in their home. So this is another way that coercive control works in holding a home over someone's head, that you have to engage in behavior you wouldn't otherwise engage in. So these are examples of some of the questions, but one of the things that is important, again, is engaging with your local domestic violence program. So if you are working with someone who you think may be surviving domestic violence or may have ongoing sexual assault occurring in their life or experiencing significant trauma or any sort of trauma from a sexual assault that occurred, or maybe engaging or having survived human trafficking, being able to reach out to your local domestic violence organization is really important to sort of play that out with them. And this is something that as a provider, you can do without disclosing any personally identifying information. This is just a conversation that you have between providers seeking professional support, which is really important. If you don't have a relationship with your local domestic violence organization and you'd like to, please contact me. I can help facilitate that. And if your local domestic violence organization is on the phone 24 hours a day, it seems, and unable to get back to you in sort of an urgent matter, you can always reach out to me, and I'm happy to problem solve these situations with you. I've done that frequently with 211 and with the regional managers, and that I think has proven to be beneficial. And so I'm happy to do that also. But really, it's that relationship with your local domestic violence organization. So you don't have to be the expert in fleeing and what that means. They are. But the document that was provided is going to be really helpful in helping you understand that more and helping domestic violence organizations understand that more to make sure we're all using the same definition and being able to move through this in the same way. You can go to the next slide.
So I just want to echo what Maria just said about partnering with your DV organization in your community. I think that the work that the CoC has been able to do really over the last year and a half since Maria has come on board has been far more strategic and far more inclusive and far more representative of the needs of survivors and sort of the thinking among DV programs, and that's come from collaboration between us and between the work of the CoC and the work of PCADV. And so we certainly hope that that is something that is really embraced and implemented throughout the CoC. Speaking of which, I have to say that when this has been a real learning experience for me, because Maria said her expertise is around domestic violence, and mine certainly is not. So I have learned a lot through this new partnership between PCDV and the CoC, including all kinds of enlightening moments. And Maria just talked a couple slides ago about the idea within the Category 4 definition of has no other residence. And when she interpreted what that meant to her, it was a skeptical eyebrow raise for me because it sort of is counter to the requirements for every other population, for every kind of intervention that can be provided through the CoC, et cetera. So, of course, I did what I do, which is to write to HUD to say, can this be real? And so this is an excerpt from the answer that I got from HUD that I wanted to share. It's also, if you look at the PDF version that Brendan sent out and provided a link to, the full response from the HUD Ask a Question help desk is provided there. So basically what they say is a household would meet Category 4 of the definition of homeless if they are fleeing or attempting to flee from domestic violence and meet all other requirements, regardless of where they are residing, including staying with friends and family. And so, Maria said just a moment ago that that includes doubled up, especially when the situation is such that it's not a sustainable situation and they can't stay there either due to housing restrictions or lease restrictions or the family members or, the abuser knows where friends or family live, which will put the individual at risk, etc. So regardless of where they are still eligible for assistance under Category 4. So we wanted to just really focus on that for just a minute, let it sink in, and encourage you to ask follow-up questions if they exist, but to really provide as much documentation as we could from HUD to really reassure folks who are, in fact, enrolling folks in Category 4 into their programs that this is they are, in fact, eligible under the definition being discussed here today. Next slide.
So HUD also clarifies that the level of danger experienced by a survivor should not dictate whether or not they are eligible under Category 4. We are not here to tell a survivor that they haven't experienced enough violence to be considered a survivor of domestic violence. This dangerous or life-threatening language that was added to the definition is something that was not recommended by our federal partners, and they actively work to try to keep it out, but that is not what was able to occur. And so dangerous and life-threatening is a phrase that is in the Category 4 definition, but it should never be construed to describe the level of violence needed for a survivor to be considered homelessness. And HUD has gone on to say in clarifying statements that interpersonal violence is inherently dangerous, no matter how it's occurring. Not having access to financial resources is inherently dangerous. being berated every day can be inherently dangerous. Like all of these sorts of things that like we don't see as the most horrific instances of a person surviving domestic violence that we can think of. When survivors leave, what we often hear is that they could put up with the physical violence or they could put up with the sexual violence. What they couldn't put up with was not being able to feed their kids, or what they couldn't put up with was the constant beratement, or the not knowing how things were going to be on a day-to-day basis, the inconsistency from their abusive partner, and having to walk on eggshells, and the gaslighting that can occur. And so the idea that an abusive partner will do something and then deny it and make the survivor feel crazy for even believing that that could have happened. These sorts of things, that's actually what is the most damaging to a survivor. And I've heard this over and over again from many survivors that I've worked with over the years, is that it's rarely the physical or sexual violence that drives a person away. It's not being able to live autonomously and live independently and with ways that they are choosing that truly drives them to leave. And so these are the life-threatening and dangerous conditions that we want to really highlight, because they make a person eligible for housing resources under Category 4. Go to the next slide.
Oh, somehow this one is staged. If you could hit it a couple more times to make the rest of the slide appear. Up there, that's it. Thank you. Sorry about that. So the purpose of this slide is really just to say the folks that we just talked about, who meet all those different components of the definition, are eligible under all program types. They're eligible for emergency shelter, whether that's a DV shelter specifically or not. For folks who are operating transitional housing in the Eastern PCOC, we don't have dollars directed towards transitional housing, with two exceptions. There are two joint component, which is a sort of a hybrid model of transitional housing and rapid rehousing. And so please know that for those joint component programs, for your transitional side, folks in Category 4 are eligible. For rapid rehousing in Category 4, this is the one sort of caveat that I want to point out. For Category 4, folks are in fact eligible for CoC-funded rapid rehousing. If you operate ESG-funded rapid rehousing, folks just in Category 4 are not eligible. The person would have to be in a domestic violence shelter or some other shelter, but they would have to sort of cross that Category 1 eligibility for ESG funded. So that could be in a car, an emergency shelter, etc. All the different scenarios that we talked through earlier. But for ESG, it's different than CoC for rapid rehousing specifically. And then for permanent supportive housing, as long as the household meets all the other requirements, has a permanent disability, if they are chronically homeless, that would obviously be somebody who would be prioritized in the Eastern PCOC in regards to placement and prioritization within the CoC's coordinated entry system and the written standards. I will just quickly let you know that I have submitted a question to HUD about the documentation requirements needed for being able to document somebody who is Category 4 as chronically homeless. This is one of the questions that we got during the eligibility training, basically saying, how would that work? It's hard enough to sort of document Category 1 as chronically homeless. How would we document Category 4? And so I've asked for some follow-up. This question was submitted back in May, and I have not heard back yet. I have been told that Category 4 can certainly be considered eligible under the chronic definition, but I'm still awaiting some additional guidance for that form of documentation, just so you know. Next slide, please. Okay, this is my favorite slide. We're going to talk about documentation in the most nutshell way, but nonetheless, a cute little image there. It's a repeat if you were at the eligibility training, so I apologize, but I think this one is worth repeating. Next slide, please.
So to document Category 4 eligibility for victim service providers, specifically, all that is needed is an oral statement by the individual or head of household who is seeking services, saying that they are fleeing, they have no subsequent residence, and they lack the resources to obtain another residence. If you are a victim service provider and you are listening to this webinar and you would like an example of an eligibility form that a person can sign and then that you can sign to put into their file, please reach out to me and let me know, and I'm happy to provide that for you. It's very simple. This is not anything for anybody to overthink. This is just something that a survivor needs to sign to make them eligible under Category 4. Next slide.
So the information that Maria just reviewed was for victim service providers. The next two slides are for non-victim service providers. So I'm just going to read here: oral statement by the individual or head of household seeking assistance that they are fleeing. The statement is documented by self-certification or by the caseworker. This is the difference. The next sentence is the difference between victim service providers and non-victim service providers, and the information on the next slide. So whereas when someone goes to a victim service provider, this information does not have to be verified in the same way by the fact that they are receiving services from a victim service provider, but where not, and safety is not, you're not going to jeopardize the safety of the household by verifying this information. It must be verified. Examples of ways that this documentation that we're going to review can be verified would be a letter from a domestic violence agency if the household has received services from the DV agency in the past, if they have a protection from abuse order, if there's a police report. There are other examples. I just want to be really clear, though, that the intent here is not to slow down the housing placement process, nor to say, nor to put someone in jeopardy in order to verify this information. And if they don't have, for example, a protection from abuse order or a police report, that's not cause to deny them into the program. So that's one of the things that HUD specifically talks about when we talk about housing first and lowering barriers, is to really ensure that folks who are experiencing domestic violence are not being sort of prevented from accessing resources as a result of their domestic violence, whether that be that they don't have a way to quote-unquote prove what they're saying is true and correct, that if they have evictions, for example, that have come from issues that have occurred in the house where the health and well-being and peace and quiet of the other tenants has resulted in them being evicted, or other circumstances. So I just want to be clear that while it says that verification should occur, it should only occur when the circumstances are aligned to these points. Next slide, please. So in addition to the verification just reviewed, there's an and there, so it says and certification by the individual or household, by the head of household that no subsequent residence has been identified, and self-certification or other documentation that the individual or family lacks the financial resources and support networks to obtain other permanent housing. So hopefully the most of this really aligns with your intake paperwork, et cetera, already. And if not, and if you need assistance in really having some language for verifying the eligibility of survivors and you're a non-victim service provider, please let us know, and that's something that we can either work on collecting from other programs or developing if that's needed. If you are a non-victim service provider and you have a form specifically dedicated for Category 4, or you have language within your documentation that you think is the bee's knees and really worth sharing, please feel free to send that to us, and we can obviously circulate it to others and get it posted on the CoC website as an example. Next slide, please.
So I just want to reiterate that no program, no housing program, no domestic violence program can require anyone to, first of all, report the domestic violence, and no one can require a survivor to get a protection from abuse order. Those are things that I hear every once in a while that are being required, most likely not by CoC programs, probably by folks that are outside of the CoC, but I just want to make sure that's stated and make sure that's clear. And if you have any questions about that, I'm happy to talk to you more about why that can be really dangerous and problematic, aside from it being out of alignment with Housing First work. So we have a couple examples here of documentation. The first is Rebecca and her 2 children are staying in a DV shelter, and they are referred to Rapid Rehousing Services through Connect to Home. And she informs the Rapid Rehousing provider that her husband hit her and one of her children has no money and nowhere safe to go. They both have significant bruises on their arms. So this is a very obvious situation of domestic violence occurring, but again is not the only way in which domestic violence occurs. So oftentimes we do work with people where they have been beat up and we can see that. But the majority of the time we are not going to see, visible bruises on people's bodies. That does not mean that we should not believe that they are survivors of domestic violence. The important piece of this, though, is the documentation that's required. Is that because she's in a DV shelter, she just needs a verification that she is fleeing. A lot of times in domestic violence community, what we call that is a verification of homelessness, and that's that form that I referred to earlier, that if you need an example of that, let me know. You can go to the next slide, Brendan. So this is an example of Susie leaving her home because her boyfriend hit her and she does not feel safe returning. She has no money and nowhere safe to go. She's currently staying with her mom and is being enrolled into a rapid rehousing program. So this is an example of what a housing homeless program would need to make sure that Susie's file is complete. And that is a self-certification of fleeing with a caseworker certification if safety is not jeopardized. And then she would need certification that no subsequent residence is available and that they lack the financial resources to support or to obtain other permanent housing. So this can be shown through income verification. This can be shown through any other information that Susie is willing to share. But what is most important is that you believe that Susie is in fact surviving, and even though she's staying with her mom, she is still eligible for rapid rehousing because being doubled up, couch surfing, that sort of thing for CoC-funded rapid rehousing is not an issue. You can go to the next slide.
Great. So we're going to move in now to the last sort of segment of the webinar regarding the emergency transfer plan. Before we start talking about emergency transfer plans, or ETP, I might refer to it, we're going to sort of just take a step back and look a little more broadly. I've asked Maria to jump in throughout this next section. One thing that when we were working on creating the emergency transfer plan and now sort of working through the implementation of that plan, it seems like my brain consistently forgets to add the caveat, assuming that a release of information is signed. So I'm going to just say it up front now. I'm assuming Maria is going to jump in and say it at least once, if not more than once. But know that that's sort of a given, that when we talk about some of the information presented on the next several slides, that there would be a signed release of information. I'm going to say it at the beginning and hope that I can just sort of like lay that as a blanket over everything I'm about to say. And that's, oh, thank you. So with HUD's VAWA final rule, so VAWA was reauthorized in 2013. VAWA, in case you don't know, is the Violence Against Women Act, VAWA for short. HUD implemented the VAWA final rule in November of 2016. Regulations went into effect in December 2016, with implementation required starting in December of 2017. And so for most of you, that means that the information presented here is now relevant to your CoC-funded projects. I can't speak specifically to the date for ESG. If that is a question for you, we can circle back to that. But I wanted to just make sure that folks know that this information, if you're not already doing it, is something that we hope that you begin to do very soon. I will also just respond. There was a question that was posted. It says, does a couch surfing DV person qualify as homeless for the PIT count? Great question, Larissa. The answer is no. For the purposes specifically of eligibility, somebody who is DV and is staying at their mom's house on the couch but can't stay there, that person would be eligible for CoC-funded rapid rehousing, was what Maria was just speaking to. But in terms of the PIT count, whether they're domestic violence or not, somebody who is doubled up in that situation would not be counted during the PIT count. But great question. Next slide, please. So given that this was incorporated into regulations a couple years ago, I wanted to make sure that folks knew there's a handful of areas where VAWA is referenced within the CoC interim rule. You might be thinking, what is the interim rule? Those are the CoC regulations. They have never been finalized. They were published back in 2012, and we're still waiting for a final version. HUD has said a couple of times that we should expect it this year and last year and maybe even in 2017, but we haven't seen it yet. They said that they're really going to get an awesome version of it out by the time that it comes out. So all this waiting will be worth it in the end. So that's good news. So within the CoC regulations, Section 578.99 Part J, protections for victims of domestic violence, dating violence, sexual assault, or stalking. Basically, the real reason I just put this slide up is to say to everybody, if you have CoC funds, whether they were used for acquiring your building, rehabilitating, creating new construction or leasing, providing rental assistance, or operating, this applies to you. We haven't awarded funds for acquisition, rehab, or new construction in a significant number of years. On a different webinar, I can explain why. but we have not, any projects that previously had those funds allocated and they're not renewing those dollars. I do not believe that you are covered because that would have happened in advance of this final rule being issued, and it's not retroactive. So for those of you who have leasing, rental assistance, or operating, this does apply to you, this being everything we're about to talk about. Next slide, please. So these are a handful of components of the VAWA HUD final rule. We are not going to talk about these. As we were preparing for today's webinar, it became really clear to me and Maria that we could probably have a full day's training on this topic, not that we need to. I'm going to direct you to some additional resources that can help to provide some additional information on all of these components. We're just going to talk about a handful of them that you need to know for A, best serving survivors, and B, keeping your project in compliance with HUD requirements. So the things that we're going to really talk about, not in this order, but notice of occupancy rights, emergency transfer plans, and lease addendums and rental agreements. I will tell you that there is not a lot of information available about the components of the rule. HUD has done 2 webinars which are linked in the next to last slide that we're going to cover today. But there's not, in terms of the way that HUD has sort of blanketed their website and really blasted out a lot of supporting documents when there have been major changes, I would say that this has not had that sort of level of guidance provided by HUD. And so I say that only to say that there may be questions once you hear today's webinar. Please feel free to follow up with either myself or Maria. I can tell you that I still have questions after having read the information that is available multiple times. I still have some questions that I'm unclear about. So hopefully, if we can't answer your questions, we will have heard or we'll be hearing back from HUD shortly. Next slide, please. So in the CoC program, there are a number of things that are required in regards to notice of occupancy rights. So there it says in the CoC program, the notice of occupancy rights, which is a form that is linked, and victim self-certification form must be given to a tenant by the recipient and subrecipient. So the like I said, the VAWA notice of occupancy rights, there is a sample from HUD that it sort of like has spaces where there are underlines where you can put in your program name and the contact information for your program. But there is a template of this that HUD has provided, and it's linked at the back of the webinar. And the second document that's referenced here, victim self-certification form, within the emergency transfer plan that has been created on behalf of the Eastern PA CoC, we have taken HUD's sort of fill in the blank sort of form and revised it for the purposes of the Eastern PA CoC's emergency transfer plan. So again, that's linked on the CoC website, and we will make sure if you don't have access to that, that you get access. But we have provided a form that we're asking folks, if you have somebody who does in fact need to self-certify and request an emergency transfer plan, that you use the CoC's form. So when does this form need to be given? These forms, I should say, when a program participant applies and is admitted to permanent housing or transitional housing, when an individual or family applies and is denied permanent housing or transitional housing, when a program participant receives notification of eviction, and when a program participant is notified of termination of assistance. These are all things directly from HUD's rule and these are specific to CoC-funded projects. I'll add that in tenant-based rental assistance, it also must be given by the owner when a tenant receives an eviction. The next slide talks about the notice of occupancy rights that are specific to ESG. You will see that the list is not that different. One of the differences is that first bullet, when a program participant begins receiving ESG, rental assistance, the previous slide said, is admitted to or applies for, as opposed to begins receiving. Just a nuanced difference there. The other thing is that the third bullet down specifically talks about receiving project-based rental assistance. That's not spelled out in the same way within the CoC required notice of occupancy rights. So what is this saying? So basically it's saying that you have to give information to folks who are being enrolled into your program at these different points in time, primarily when they're applying, and if they apply and they're denied, or when something is going wrong and they're being evicted or assistance is being terminated. So beginning and end, if that's a way to help remember when these notices need to be provided. Next slide. So I told you we're just going to sort of bounce through some components of the rule. Another one I wanted to speak to was lease addendums. All agreements between the landlord or owner and the tenant in a CoC or ESG assisted housing should be outlined in a VAWA lease addendum and must include the following elements. And there are 5 different bullet points there. What I can tell you, rather than going through those and talking in great detail, is that, again, there's a slide of resources that's at the end of this presentation where we have provided HUD's sample lease addendum, which will meet each of those different bullet points listed there. So this is a second requirement that you may or may not currently be doing as part of sort of the workflow for enrolling folks into your program. In addition to what they're providing the documents to the program participant about their occupancy rights, now there's a document that will go to the landlord or the owner of the unit where you're providing ESG and CoC funding. So this is a second new requirement. Next slide, please. So similar but slightly different. We have projects who receive leasing dollars. We have other projects that receive rental assistance. Rental agreements for CoC and ESG recipients must outline the VAWA protections in all rental agreements or housing assistance contracts with private housing owners and managers, including, and then we've got more bullet points here again. So again, looking at the lease addendum that HUD provided, which is linked at the end of the webinar, incorporating that into the lease that you all signed with the landlord in terms of your rental payments to pay the balance of the rent not paid by the program participant. This is something that moving forward you're going to want to incorporate into those rental agreements. If you already have a rental agreement, I'm not aware that you need to go retroactively. I will tell you that these requirements were included in probably your current contract year with HUD. When you signed it, I don't know if folks then looked into what does this mean and how do I meet these requirements or not. If you look at your current contract and it does include this language, I would encourage you to go back and to provide some education to your current landlords around these requirements and providing them with the forms, as well as your current program participants, so that you're in compliance with your current grant. If that language is not there, then I would say that being prepared to implement these requirements at the start of your next grant year would be advised, because this will be in your next grant if it's not already in your current grant. Next slide, please. So a couple other things. I mentioned we were going to really hit on 3 different areas. This is the third area that we wanted to really make sure that folks were aware of: the Emergency Transfer Plan, or the ETP, the interim rule or the CoC regulation. Specifically mentions the Emergency Transfer Plan in a couple of different areas. One, it says, as you can see, Section 578.7, Part D, VAWA Emergency Transfer Plan. The CoC must develop the Emergency Transfer Plan for the continuum of care that meets the requirements. I don't know what happened to the MENTS there on that slide, but nonetheless, it must meet the requirements. The other thing is that CoC-funded programs are required to have emergency transfer plans within their policies and procedures. The intention of the version that was created for the CoC was that folks would be able to incorporate that into their organizational policies and procedures, or not their organizational, but their project policies and procedures as well. So please know that even though it's not listed here on that slide, there are some requirements around projects having an emergency transfer plan process. That is met through the CoC level ETP, but it should be incorporated into any formal documents about policies and procedures that you have for your program. So we're going to talk about what the ETP is and what it requires you to do, etc. But before we do, because I know that you're going to hear this and you're going to think, we have to do what? I want to just reassure you that, as you can see here for 578.51 Part M, VAWA Emergency Transfer Plan costs, recipients and subrecipients of grants for tenant-based rental assistance may use grant funds to pay amounts owed for breaking the lease if the family qualifies for an emergency transfer under the emergency transfer plan that's been established. So all of that is to say that as you listen to the next several slides, please know that this is really what is going to be required to ensure the safety of an individual or a household, and B, it's required in the CoC regulations, and C, you can use your CoC funding to facilitate any moving that is required. Next slide, please. So before reviewing what's on this slide, I'll just say that one of the things that HUD has really emphasized is that the emergency transfer plan allows survivors to prevent homelessness due to domestic violence or sexual assault. Under VAWA, ESG and CoC funded programs are required to have the emergency transfer plan in place, as are CoCs, and in order to really ensure that rather than simply fleeing the current residence and perhaps the person who is abusing you, that how can we approach this differently to ensure that that does not happen? So I just want to bring that to the forefront because I'm concerned that folks might think this is just more work for us. Well, it might be more work for you, but at the benefit of somebody who otherwise is potentially in a life-threatening or very serious situation. So as I mentioned, it's a requirement. So,
real quick.
Yep.
I think, too, that it's a good frame for this is that oftentimes landlords get really uptight about domestic violence occurring on their property, and rightly so. And this is the emergency transfer policy is a great way to make sure that if DV is occurring, there's a remedy. Because oftentimes it's really hard to break a lease and to get people to move and to pay the, extra deposits and all of these things. Like, although it is more work, it actually, landlords complaining about domestic violence and being concerned about domestic violence is such a significant thing. This really addresses that.
Great. So we've talked a little bit around it. So what is it? What is the emergency transfer plan essentially doing? It must allow survivors of a VAWA-defined crime to transfer to a safe dwelling unit under a covered housing program under these particular circumstances. That there is a transfer that's requested, and the provider reasonably believes that they are threatened, that the victim or the survivor is threatened with imminent harm if they stay in the same unit. Or alternatively, and I can't explain this one, so please don't ask questions, but in the case of sexual assault, if the sexual assault occurred on the premises within 90 days of the request for transfer. I'm not sure why sexual assault is pulled out as its own little caveat there. I don't understand necessarily the 90-day request limitation. I don't know if that's something that Maria can or wants to speak to. I know that she and I have talked about it before. I'm providing you with the information because it's how it's written within the regulation and the final rule. But if you have pretty substantial questions about it, I'm not going to be able to answer that without getting some additional clarification from HUD.
So I've gotten more information on that. And the reason that it is laid out within 90 days is that oftentimes sexual assault survivors don't report the assault immediately. And so they put sort of a 3-month mark on it for them to be able to, giving folks time that, like, if they didn't report the assault initially and then there's continued issue, or they're feeling trauma by continuing to reside in the same residence where the incident occurred, but the incident happened what could be considered a while ago, they still have 3 months to report and to request a transfer. Not to report, to request a transfer, excuse me.
Thank you. Great. So next slide, please. Okay, so we've now explained the different documents that must be provided to both the program participant and the landlord. We've told you now that through the ETP that the expectation is that if somebody requests a transfer due to safety concerns, that needs to be granted. We've told you that you can use your money to pay for it. Now we're going to talk in a little bit more detail about when that may need to happen and at what point, like who you need to talk to potentially for support of honoring this request. I'll just say again, I know we've said this a couple times, partnering with your DV organization is a really great idea when something like this occurs, assuming you have a release of information and you can reach out and engage your DV organization. If not, you can always encourage or ask the survivor if they would like to receive assistance from the local DV agency as well. We would certainly encourage that. So if somebody contacts you and says, and basically lets you know that they have this request, even if they don't use the right language, provide them with the form, and assuming that everything makes sense and you need to honor that request, there's a couple different ways that this can be handled. So, and I'm going to talk about each of these. An internal transfer. So when a survivor can safely transfer from or move from one available unit to another without having to apply as a new applicant. So, so basically, if you operate, let's say, a rapid rehousing program, or even a permanent supportive housing program with rental assistance. You have an agreement and a lease exists between the tenant and the landlord, and you have either a secondary lease or it's a three-way lease to cover part of the rental assistance. In this case, because it's basically tenant-based rental assistance, you would be able to move that individual from one unit to the next. So the lease addendum that we've talked about earlier includes things like basically notifying that through CoC-funded programming, there may be circumstances in which you have to break the lease. And so this would be one of those situations where if the person requesting the transfer needed to move from one unit to the next, you would need to honor that request. Certainly there is choice, ensuring that the survivor ends up in a unit where they feel safe and their ongoing safety will not be at risk is of utmost importance. Engaging, again, the DV organization to help facilitate those conversations is certainly encouraged. The main point I want to make here is that if you have the ability within your project to move someone, like through a tenant-based rental assistance, through rental assistance, et cetera, that is something that is expected of the provider. That would be really considered an internal request. It could be that you have relationships with landlords that have multiple housing units, and the landlord could even help to facilitate that through their own inventory. So it's not even something that would require moving from apartment A to apartment B, and therefore engaging landlord A and landlord B. Landlord A may have 5 different units in the community and an opening in another one of those units to help facilitate that move. I bring that up specifically because I know I've talked to so many folks about landlords and engaging landlords and really trying to ensure that landlords are happy and really feel like any additional work is worth that for the additional assistance that is provided to CoC-funded projects. I'm sorry, my computer just somehow went black as I'm talking to you, and I can't see the slide anymore. I'm hoping that my typing will somehow make it reappear. And if not, then we will wing it. It's coming back up. Sorry. All right. Technology at its best this morning. So that's an example of internal transfer. I wouldn't get too caught up. Brendan, if I can't see the slides anymore at all, should I, is there something I should do, like hang up or call? No, I don't want to hang up because I don't want to get disconnected from the phone.
You could exit the Skype meeting and rejoin the Skype meeting, or just pull them up outside of the Skype if you want to just open up your own PDF. Okay,
sure, I'll do that. So I would encourage you not to get too caught up on the internal, external information that's presented on this slide. We're going to talk about it more broadly than that. These are really just here to help reinforce the different types of situations that we're talking about. So if you have the ability to transfer somebody within your existing inventory, I talked about rental assistance. That's the only one I've specifically talked about. If you have multiple buildings, let's say you receive operating dollars through the CoC, and you have 2 different buildings, one on one side of town and one on the other. If you have somebody who requests a transfer, you could certainly move them to your other building. Frankly, if they feel like it would be safe to remain in that building, but in a different unit, that is something that can also be facilitated. Again, one of the key things is to continuously engage the survivor about what safety means to them and how their safety needs will be met. In the event that you have, the same would be applied for leasing. If you, as an organization, lease a number of units with CoC funding and they're scattered across town, you could certainly work with the survivor about moving from Unit A to Unit B there. If for some reason that is not possible, and what I mean by that is that let's say you have a building and you only have one building, and remaining in that building in a different unit is not a situation in which the survivor would feel safe. You need basically what's called an external transfer. And so here's what I want to emphasize. When that happens, that basically means that that person is going to need to receive assistance from a different provider when we talk about external transfer, because for whatever reason, the resources that you have do not allow for you to serve that individual. So it would not be, for example, if you have rapid rehousing. If you have rapid rehousing, you're always going to have an internal transfer. If you have permanent supportive housing and you are serving folks through rental assistance, you are always going to have an internal transfer. If you have one building or only a couple buildings and you don't have the ability, because you don't have any vacancies, to move somebody into another building or another unit, then you would need an external transfer. If you have leasing dollars, I can think of examples where it could go either way, but hopefully you would be able to do that internally. There could be some examples where an external transfer would be required. But most programs at this point should be able to use their existing resources to do an internal transfer. If that is not possible, we're going to talk in more detail about that and what happens. Safe unit is another term that's defined here, and it's defined as any housing option that a survivor determines is safe. I was mentioning that getting the input of the survivor is of the utmost importance. Available unit, not defined in the rule, but HUD guidance has instructed communities to locally define based on reasonable move-in time. And so I think it's important to also talk about safe and available sort of in tandem with each other. It could be that for any reason that there is not an immediate transfer that occurs. And we're going to talk about timelines, but I do recognize that depending on the circumstances, you may have to find a unit, you may have to have an inspection of that unit to ensure it passes housing quality standards, etc. These things certainly should be expedited for the safety and benefit of the survivor, but everybody knows that there are aspects of this that take time. Within that consideration, I would really encourage folks, this is another way in which it would make sense to have your DV organization involved, because you may need some type of interim step for a safe and available place that survivor can go outside of their current unit where it's no longer safe. Next slide, please. I can't see it, but I'm going to assume that it's advanced. The Eastern PA CoC developed an emergency transfer plan so participants in homeless assistance projects who are victims of domestic violence, dating violence, sexual assault, stalking, and or human trafficking can be safe and have access to stable housing. That's something that we've already talked about. As I mentioned, the version that's created for the CoC can be adopted by your program as well. This is just sort of restating a couple of things that we've already said. In accordance with VAWA, the CoC programs must allow for transfer from the current unit to another unit within the program or externally. So within the program, again, would be internal, and then outside of the program, external, just to sort of re-summarize that. Next slide, please. So the next slide really talks about the timing and the availability. I'm just going to, this is a little dense, but I'm going to read through it because I don't want to, it's got a lot of details in it that I don't want to accidentally skip over if I just sort of paraphrase. The housing provider must accept or reject the emergency transfer request within 5 days. So if somebody comes to you and explains the circumstance, whether or not they bring this form to you in hand, the form should be provided to them. They may need assistance completing the form. I don't think we should assume that everybody in our projects can read and write or are proficient in English. They may have another language as their first language, so please be mindful of that. If the request is accepted, providers have 10 business days to complete the transfer. We recognize that 10 business days is tight. The idea there is to try to expedite a process, again, to really help to protect the individual who is, in this case, fleeing. If I'm not encouraging in any way, shape, or form with this statement for folks to sort of drag their feet on that. This is something that we do intend to sort of track and really try to understand what the timeline looks like so that the plan eventually can be updated to be a more reasonable timeline. That being said, we would certainly hope that this is something that could happen within a 2-week period of time or 10 business days as indicated here. If the housing provider accepts the emergency transfer plan but is not able to provide an internal transfer, an external transfer will be facilitated through Connect to Home. So,
Sure Housing, Larissa speaking. How may I help you?
Hi. I'm not sure if you can hear me because it sounds like you're on the phone, but somebody's phone just unmuted. Hopefully you know who you are and can remute your line.
She's muted.
Thank you. So Connect to Home is the coordinated entry system for those of you who aren't familiar with that term. So again, if you have somebody who needs an external transfer, they need to be enrolled in another program because let's say you have one building, you don't have the ability to move somebody, you would request that external transfer, and that could help be facilitated through the coordinated entry system.
Hello, Leigh. Oh, looks like her call dropped. Just one moment, everyone.
Mine did that earlier, so I can pick up where Leigh left off. So one of the best things that can be done if an emergency transfer is needed is to connect with your regional manager immediately. And then also you can connect with Kayla, who is a new staff person that we have. Is working for transitions of PA, but is the DV coordinated entry specialist for the CoC. So she's not a CoC staff person, she's a transition staff person, but is also more than happy to help facilitate this process. We want to make sure that it's done as quickly as possible and make sure that the survivor is moving forward in the process as quickly as possible, and that you're not alone in it.
I'm back too. I don't know if can anyone hear me?
Yes.
Oh, great. Sorry.
So to make sure that the survivor is not alone in the process and you are not alone in the process, feel free to reach out for support and community coordination. I don't know what you were going to say, Leigh, but I just said some stuff. So
terrific. Man, this is it seems like if it can go wrong, it will go wrong. I'm waiting for a spaceship to land right in the backyard of where my office is at this point, because it seems like there's just weird things happening. Anyway, so what I was going to say is if you have to go through Connect to Home, the coordinated entry system, that a regional manager will be prepared to help you through that process. And then I'm ready for the next slide. So households awaiting an external transfer through Connect to Home are to be prioritized for the next available unit for which they're eligible. So what this means is that if somebody was in a rapid rehousing project that shouldn't be, but for some, I can't even imagine what it would be, but for whatever reason, they needed an external transfer, that would need to, they would remain eligible, they would maintain their eligibility for another rapid rehousing project. I think a better example of that would be a permanent supportive housing project, which could be either site-based or leasing and have some barriers to moving somebody through an internal transfer. If there's questions that come up that are specific to eligibility, please know that you can certainly send an email to the CoC's email address, which is easterncoc@pennsylvaniacoc.org. You received, information from that website when you registered for today, so hopefully you already have that email address. You are certainly welcome to submit questions around eligibility, but know that if somebody is in rapid rehousing and needs to transfer out an external transfer, again, that shouldn't happen, but if it did, they would still be eligible for rapid. If somebody is in permanent supportive housing and needs a transfer, that's a little bit trickier, and the reason why is that there are far fewer permanent supportive housing openings throughout the CoC than there are rapid rehousing, which happens more rapidly, and there is more turnover. And so that could be a little bit more tricky, where you may have to move somebody into rapid short term until a permanent supportive housing opportunity was made available. It doesn't mean that the individual would have to move multiple times, but if something like that comes up, please feel free to reach out to us, and we can sort of help you think through that situation. Due to the emergency situation, these households should not be added to a waiting list and left to wait until they are reprioritized. And so what that also means is that if somebody was in permanent supportive housing and needs a unit, we would not just leave them there until there is a permanent supportive housing unit available. By leave them there, I mean on a wait list. That's why I mentioned that they may have to move into a rapid rehousing or something like that. It also means that the regional manager can help to assist to identify an available unit. So hopefully you already know programs in your community and have relationships with them, and can find out if if any of them have openings or can absorb another project participant. Where it may be more difficult is when you are in one community in the CoC and the survivor indicates that they can't stay in that community any longer because of safety concerns, and they need to move to another county. You may or may not know the contact information or the CoC partners in that community. And again, this is where the coordinated entry regional manager can really help to facilitate that process. If a participant reasonably believes a proposed transfer would not be safe, the participant may request a transfer to a different unit. This goes back to something we've talked about a couple times, is that it's really up to the survivor to define where they would be safe and what safety means to them. If a unit is available, the transfer participant must agree to abide by the terms and conditions that govern occupancy in the unit to which the participant has been transferred, which is a legalese way of saying they have to abide by the lease, which you already know. Neither the provider nor the regional managers may be able to transfer a participant to a particular unit if the participant has not or cannot establish eligibility for that unit. So again, assuming that somebody is in permanent supportive housing in County A and needs to move to permanent supportive housing in County B, or even rapid rehousing where a program doesn't have the ability to engage landlords in another part of the CoC. There's the assumption that due diligence has been done, that the paperwork, that the verification of homelessness, all of the various things that we've talked about has been done, and hopefully that file, if there's a release of information available, can be shared. And there's also this presumption of eligibility based on the fact that they were transferring from an existing rapid rehousing or permanent supportive housing project. Next slide, please. So this is the one slide I don't have in front of me, but this slide is to provide some resources of things that we've talked about today. So that would include the CoC's emergency transfer plan. I know Jessica has linked it here on the website within the on the Skype within the chat box there. It's also provided here on this slide. Two other things that we mentioned, this is sort of out of order, but bear with me. The VAWA lease addendum. So this is the lease addendum that would be going to landlords. There's the HUD example there. Below that, the last link listed is the notice of occupancy rights. That's something that, again, it's like a fill in the blank that's needed for program participants. And that's all program participants. It's not that if your program participant has a history of domestic violence, this should be provided. This is for any of them. And so any of them meaning all of the program participants that you're serving. Two other resources that are linked here are webinars that HUD has conducted on this topic. If you take the time to listen to them or read the transcripts, you will see that there are a lot of details, as I mentioned earlier, that we did not get into today. It includes things like if you have a household, let's say a family, and one member of that household needs to flee, what happens with the lease? And the individual who is remaining in that household, what are their rights in that situation? It's called lease bifurcation. So that is one of the things that's included in one or both of those two HUD webinars. They also get into other aspects of this, including confidentiality and documentation, etc., but also some of the topics that we've discussed today, but in more detail. The other form that we talked about, again, just to mention, this is the form that the survivor would complete, the request form, if you will, for a transfer, and that particular form is at the back of the CoC's emergency transfer plan. So we will make sure that folks have access to all of these. They're linked here on this slide, but we can also add links to the CoC website for easy future reference. I don't know if folks have questions. I feel like that was a lot of information there at the end, and could be potentially significant changes if you weren't already aware of your project level emergency transfer plan requirements. I think as folks go back and read the plan, look at these attachments, and review what's in their contract. If you have questions that come up, certainly feel free to reach out to either myself or Maria. If you reach out to me, please don't send it to my email address, but send it to the CoC email address. You'll get a much more timely response because somebody will be able to respond whether or not I'm in the office or out of the office on that day. Any questions? I know that folks have been looking at the chat box. We haven't seen any reactions you want to share? I know we're almost out of time. For those of you who are still on the webinar, thank you for trudging through our technical difficulties this morning along with us. Hopefully that won't happen in the future, but we appreciate your patience with that. Maria, is there anything else that you wanted to add? I'm not sure if you're talking, but you are muted if you are.
Sorry, my screen just went blank. No, I'm good. Thanks.
Great. All right. So if there are questions, tomorrow, next year, except next decade as it is, please feel free to reach out. And if we start to get a lot of questions and realize that we need to provide additional training or reference materials or whatever, we can certainly follow up and do that based on everyone's needs. So thanks for participating. If you are on the call, please make sure Brendan talked earlier about the forms that need to be completed. Brendan, I don't know if you want to mention that again in case somebody wasn't on it right at 10.
Yep, I was going to follow up. I did record this session. That should be posted to Workplace and the website most likely later this afternoon. And along with it, I will attach the attendance survey. If you were participating in this meeting or in this webinar, please complete that to make sure that we track your attendance. Thank you, Leigh and Maria, for guiding this webinar. A lot of good knowledge in here. Thank you.
Thanks, everybody.
Thanks.